Hi everyone, I'm Cheryl McQuire. I'm an SPHR Post-doctoral Launching Fellow based at the University of Bristol. And today I'm just going to give a brief summary of some of the work that I did on a practice placement that was part of my fellowship. My placement was based at North Somerset Council with their public health team, and I was on the project from December 2020 to February 2021 for approximately 1 day a week. A key purpose of my involvement in the placement was to help to develop the health and wellbeing strategy for North Somerset. The key aims of this strategy were first to capture a shared vision for improving health and wellbeing and for reducing health inequalities in the area. So this was the big picture. What did members of the community want health and wellbeing to look like in the future? We then wanted to capture what priority areas were for different members in the community, and this was to be addressed through system-wide partnership and action. This plan was to be formalised in the action plan with a series of key targeted outcomes and recommendations for how we might realise this shared vision and address these priority areas. Just to give a little bit of context about the key health outcomes and challenges in North Somerset. So cancer and cardiovascular disease were key factors of early mortality in the area. And leading causes of morbidity included musculoskeletal conditions, mental illness, and substance use disorders. Now, there's some quite large discrepancies in healthy life expectancy in the area, up to about 13 to 14 years difference between different areas. So there are clear health inequalities that are present in that community. In terms of substances, smoking is quite prevalent with nearly 20,000 current smokers, and there are above average rates of alcohol-related hospital admissions. In terms of different concerns for different sectors of the population, falls were a leading concern for individuals aged over 65. Nearly 10% of children were residing in low-income families, and nearly 2/3 of adults have an unhealthy weight in the area. So the health and wellbeing strategy that we're looking to develop takes into account a range of different strands. So firstly, we needed to be mindful of existing strategy and policy documents, such as the Department of Health Key Outcomes, as well as local policy, including North Somerset's economic and corporate plans. We also wanted to take into account existing data, some of which was presented on the previous slide around key drivers of health and wellbeing need, as well as undertaking a literature review, so what works to address these different areas of need. Finally, we were undertaking some primary data collection through an e-survey and also through stakeholder workshops and meetings. My particular objectives included leading on the design and delivery of these public and stakeholder engagement workshops, to analyse the e-survey data and to conduct this appraisal of health need and evidence review of effectiveness. The workshops took place throughout February. We had 3 public and 3 stakeholder workshops conducted virtually, and these lasted up to 2 hours. The workshops were structured as such that there were 3 sections that tried to capture vision, priorities and actions for health and wellbeing in North Somerset. And we originally incorporated a range of different mediums to try and increase engagement during the workshop. And this included a Padlet exercise where participants were asked to post their ideas on what their vision would be for North Somerset Health, as well as full group and breakout room discussions. So just some reflections on these workshops. We find that in the public workshops in particular, the attendees preferred to communicate through group discussion rather than the Padlet exercise. So we adapted to this format for the purposes of the public workshops. In general, participants were really engaged and enthusiastic about health and wellbeing in their area, So discussion was quite free-flowing and captured a broad range of different areas, as well as including some really useful and insightful suggestions on the action plan, particularly around how to best mobilise the existing resources in the area to support these priorities and visions for health. It's important to note that a lot of the attendees of the public workshop often were affiliated with organisations such as third sector organisations. So we didn't perhaps have much of a lay representation as we might have liked. Recruitment was also slightly lower than expected. So I think there was an average of between 8 to 10 participants per workshop, rather than our target of around 30. And this is possibly due to more limited time for advertising. So there was advertising as part of the e-survey and in local publications, but the timescale was shortened due to delays of COVID. And so that possibly had an impact. Now, in terms of outlining what type of factors might have emerged for the strategy, the steering committee were really keen for the workshops in particular to be participant-led. So for individuals to bring their own concerns rather than the topic guide being too prescriptive. And this was really the case in that individuals did cover a really wide range of areas. That said, they were presented with this schematic up in the top left, just to encourage them to think as broadly as they could about different factors that impact on health and well-being, ranging from individual lifestyles, social and community networks, to these wider determinants. And indeed, discussion did capture quite a breadth of topic, and one thing that came out was really the interrelatedness between different aspects, different layers of health considerations within this schematic. So unfortunately, it's too early to present early findings yet because the data is still being synthesised. But this slide just gives you a snapshot of what type of concerns might be coming out from the discussions. In terms of the timeline, so my work on the project was largely concentrated up to this February 2021 milestone and included the stakeholder engagement activities, the health challenge data, and the literature review of what works. So the literature review was really quite a broad review of reviews, given the multitude of topics ranging from individual factors such as alcohol and smoking, to more of a look at conceptual frameworks like asset-based approaches that could feed into the action plan. So analysis is taking place, or has taken place, between February and March, with synthesis due to extract the key themes in April 2021. And this will be largely a thematic analysis, as well as some quantitative analysis that takes place from the e-survey data. In May to June, the team will be looking to develop their strategy and action plan in consultation with their steering group and key stakeholders, with a provisional date of July 2021 for publication of the final strategy. So here's just a little bit more information about useful contacts if you'd like more information about the health and wellbeing strategy. And just to say, from my point of view as a practice placement, I find it really useful, coming from a predominantly research background, to learn more about public health and practice, including the structure of the team, the really wide remit within which they work, and also the impressive links that the team had with existing organisations and members of the community, and how important that was to the co-development of this strategy. So overall, I thought it was a really useful exercise, and I'd recommend fellows and other people who are eligible to really make the most of these placement opportunities. I'm sure you can find out more through the SPHR training manager as well if you're interested. So thanks very much for your time.